Hi, my name is Julie Peterson. I'm a psychiatric nurse practitioner student at Purdue University Global. For my journal entry, I'd like to talk to you about some of the past experiences I've had in mental health. I have worked at a hospital for about 15, the last 15 years, and I was in the float pool, so I would float to um, mental health wards that we had. Um, so most of my experience is just trying to talk to the patient, kind of get them to try to understand what's going on with them. Sometimes it's easier than other times. If they're in acute psychosis, it's just really difficult to try to get them to feel comfortable around you. So I always just try to make them feel safe and kind of let them know that we were just there, kind of working for their safety. And then we would just see how things were tomorrow once they had a little rest or something. Um, I like to work more in community health, but the reason for that is because that just seems to be the population with the most need, and that they're fairly underserved, and they don't have a lot of options. And their diagnoses are probably just the most interesting and complex. So I do love trying to solve a puzzle anyway. And any concerns that I have about working with the population would be just to be the best that I can be and try to be there for the patient and anyone else, that's with the patient that's trying to help them, because it does take, a lot out of, family and friends to try to help patients. And then they need to, you know, try to understand that, it's a choice that they need to make and not something we can force them to do. And I think that when you try to do that, that gives them a little bit more of the power. So they're a little bit more, you know, interested in trying to help themselves. And then personal and academic goals for the course that I would have would just be to try to, continue to improve myself in the work that I do. I think knowing the medications would be good. So I'm actually a little excited about including the medications on our Court Elms field encounters that we have to do. And um, I just continue just to improve myself. That's basically all I have. If you have any comments, questions, or concerns, just email me. Thank you. Bye bye.